Kia ora everybody, good to see you all again. Just a brief update today. I'm very pleased to hear reports from the Ministry that there has been a flurry of activity on the New Zealand COVID Tracer app overnight. 11,000 new registrations overnight, so if we keep that rate up, things will be looking much better. So thank you all for your help in spreading the word. The Ministry team at the Ministry, of course, remains ready to help anyone who needs it. So please download the app and use it on your phone. And if you're a business, please make sure you have your QR code on display in an accessible place for customers. I've had some feedback that it works better if it is in front of rather than behind glass panels. For contact tracing to be effective, we need to know where a person has been, not just yesterday, but a week ago, 2 weeks ago, or even longer, and the COVID Tracer app helps people to collect that data. The COVID Tracer app has an alert feature, which is an incredibly important part of the tool. Contact alerts allow the Ministry to quickly inform people who may have been exposed to COVID-19 so that they can take immediate steps to protect themselves and to protect those around them and help us to break the chain of transmission. The app has been designed to protect the privacy of everybody that uses it. Your digital diary is kept securely on your own phone, and the Ministry of Health can't access it without your permission. It's important to note those things. We'll have further discussion in due course around other things that are being explored, and I'm sure you might have some questions on those, although we're not in a position to make further announcements on that today. But I'll hand over now for the regular update to Dr. Bloomfield.
Thank you, Minister. Kia ora koutou katoa. So today we have one new case of COVID-19 to report in managed isolation. It's now been 76 days since we had a case of COVID-19 acquired locally from an unknown source. Today's case is a child of two people, both of whom have previously been reported as cases. They arrived in New Zealand from Italy on the 4th of July, and that family is staying in the Commodore Hotel in Christchurch. And I just wanted to pause there to wish the family a full and speedy recovery, and likewise to all our people who have active COVID infection at the moment. We shouldn't forget that these are Kiwis and they have got this disease, and we do want them to recover well and fully and know that our thoughts and best wishes are with them. We've had a further case be classified as recovered, so our number of active cases actually remains at 27 in total at the moment. Our total confirmed cases is now 1,198, and we will update the WHO on that number. And there is no one receiving hospital level care at the moment. Yesterday we did see an increase in testing, a total of 2,899 tests, of which 726 were undertaken at our managed isolation quarantine facilities. So our total number of tests now completed is 436,233. We've seen some reports on social media about people being concerned about being charging for tests, and just to reiterate the point I made a couple of days ago, there is no cost for an individual to be tested for COVID-19. We have negotiated an agreement with the district health boards and with primary care for GPs and the CBAC staff to be reimbursed. So anyone wanting advice about whether they should get a test should ring Healthline, their own DHB, or of course their own GP. Just to follow on from the Minister's opening comments about the COVID Tracer app, great to see that increase in registrations yesterday. It'd be good to see that continue. The number of QR codes on display is also continually increasing, up to 78,810 now, but still a number of businesses and organisations that haven't yet got on board. I know that a lot of businesses did try to get their QR code in May and found the process overly complex. It's important for them to know that it is now a much simpler process, and it only takes a few minutes. All you need is a driver's licence, and if you don't have a driver's licence, you can still get one by completing a simple template and emailing it to the Ministry. So check on the Ministry of Health website. And just to reiterate that the NZ COVID Tracer app and any of the similar apps that are being used in other countries, and we've seen this in Australia over recent days with their outbreaks in Victoria and then the the smaller outbreak in New South Wales. The app is an adjunct to having a really good contact tracing system in place, which is what we have been working on here in New Zealand. So interestingly, if you look in Australia, they are reporting that they've downloaded information from their Bluetooth-based app as of a couple of days ago, 285 people. They didn't identify any additional contacts through that download, and likewise about a dozen downloads of the information from the New South Wales outbreak and didn't identify any additional contacts. However, the value of both the app we have and the Bluetooth functionality, which we are looking to add to our app in due course on that Apple Google platform, the value is in being able to notify people rapidly so that they can take action with either self-isolation and or getting advice about a test. So again, just a final word of encouragement of people to download the app, use it to scan. It only takes a few seconds each time you enter a premise, and that will be very helpful with our preparation, which we must all be a part of, for the likelihood of getting a community case at some point in New Zealand. Thanks, Minister.
Thank you. Just briefly before we get into your questions, a brief update on behalf of Dr Woods and the MIQ team. Yesterday, you'll be aware that around 3:30 p.m. a fire alarm went off at the Ridges, a managed isolation facility. It was accidentally triggered whilst furniture was being moved. Fire and Emergency New Zealand responded, and the returnees were safely evacuated to the designated assembly point whilst also being asked to follow social distancing rules. Due to the large number of people evacuating from the 3 exits, there was a short time where social distancing could not be strictly followed, but the health risk is considered to be low because the returnees were wearing masks, as they do when they're outside their rooms, and any contact closer than 2 metres would have been for only a short period of time. There were 154 returnees staying at the Ridges, and all have had negative day 3 tests. There has been no positive test at the Ridges for more than 3 weeks. Routine day 12 testing, of course, will still be undertaken. Facility staff saw no evidence of bubble breaking or mingling with the public when the returnees were evacuated. They were cleared for re-entry 20 minutes after the fire alarm at 3:50, and re-entry was completed at 4:30 p.m. Happy to take questions.
Dr. Hipkins, you keep talking about wanting to increase testing rates. What sentinel or random community surveillance testing, if any, is being done currently?
Look, as you see, the testing rates are starting to come back up again. The revised guidance, or the extra guidance from the Ministry of Health, was only issued just over 24 hours ago, so I think we do need to give people an opportunity to respond to that. I'm confident that we're going to see the testing rates increase. That's certainly the feedback that I've had, not just from the Ministry of Health, actually, but from GPs and others. But I'm happy for Dr Bloomfield to add to that if
I can, Minister, just to follow up on your specific question. So there is no random testing happening in communities of asymptomatic people. That's something we did through the back end of Alert Level 3 and into 2, when we were trying to identify any undetected pockets of infection out there. So this community-based testing is of people with symptoms, of which there are quite a number at this time of year. So people with respiratory symptoms, and the clarity that was provided on Tuesday was which of that quite large group of people coming through general practice every day should be being tested. And that's why we agreed on with primary care, the best group was to test, in addition to those who fulfilled the high index of suspicion criteria, to test those who would be at risk of complications, so older people, people with pre-existing conditions.
So do you think there's no need for sentinel testing at the moment?
So what I would describe that as amplified sentinel testing. In fact, what sentinel testing is in a usual year we do sentinel testing for influenza, and we have a group of 90 general practices that every week swab the first 3 people they see each week with influenza-like illness. And what those swabs get analysed at ESR to look and see if the illness the person has is influenza. So what we're doing now is, of course, looking to see are the symptoms that these people are demonstrating, and on a much larger scale, are any of them demonstrating symptoms of COVID-19. So you could argue that is, or the best way probably to describe it is very high intensity sentinel testing.
And this is for either of you, but how many staff, including security and hotel employees, are working shifts at managed isolation facilities currently, and how frequently are those individuals being tested?
So there are a lot of them. I can get you a head count number if that's helpful. As I've mentioned before, I've been to visit several of these facilities now. They are highly staffed, so there are quite a few people who spread across a number of different teams, so police, defence, health staff, and of course the people who work at the hotels as well. So I'm certainly happy to get you a regular head count, if you like, of how many people are working across all of the different facilities. The testing regime is starting to ramp up for those people. As of last week, I think that the testing regime started to kick into gear to a higher level. We are going to be getting a more detailed breakdown of that. That hasn't come through yet, but again, I'll ask Dr. Bloomfield if he wants to add to that.
Yes, so we will be tailoring that testing to the different groups of staff at the facilities. For example, the health staff are there every day. They're on shifts. In fact, there's a nurse there at 24/7 in every facility. A lot of the staff working in the facilities are Defence Force staff, and they tend to rotate in and out. So again, we're tailoring the testing to make sure that everyone rotating in and out is tested during their time there, and we're also looking at what other testing might be required when they rotate out as well.
So how frequently might that nurse, for example, be tested as opposed to the Defence Force personnel?
We're still working on that, so it could be every couple of weeks, or it could be more or less frequently. We're just working on that.
Bloomfield, are you certain that there's no community transmission?
We've got no evidence of community transmission at the moment, and I think what is reassuring there is that we are now doing the testing, of course, in anyone who is in a facility, who's coming into the country. We are detecting cases there. They are completing the full 14 days, and we haven't, in our testing around the border, including around of staff at managed isolation and quarantine, we haven't identified any cases there, which is where they are most likely to spring up. And we haven't, in tens of thousands of tests in the community over the last few weeks, detected any COVID-19 cases.
You say to reports that potentially 2 people were tested positive in the community and are not, and then were moved into an isolation.
So I don't know that specific report. We did have one person who had been a case in managed isolation, had recovered and been discharged, was then assessed at hospital again, and as part of the assessment, a COVID-19 test was taken. That test was positive. He was returned to managed isolation, actually the quarantine facility in Auckland, to be reassessed by the clinician, who assessed that the positive test was a result of residual virus, which we see, and that his residual symptoms were due to an underlying condition. So yes, I'm aware of that case, but I'm not aware of any others. Again, there's very strict criteria applied before someone is determined as recovered. Once they have been identified as a case, and they are the same criteria we've applied right from the start. In fact, I asked our team to have a look at those criteria, and I got a report back yesterday to check that we were still aligned with Australia, the WHO and other countries. One of the things we are going to do is, currently we have used the definition of at least 10 days since onset of symptoms, or since a positive test if they were asymptomatic, and at least 48 hours without symptoms. We are now going to increase that to at least 72 hours without symptoms before they'll be classified as recovered.
On the COVID Tracer app, you say the value of the app is to be able to send notifications, but as I understand it, the incident at the Countdown where the man went there from managed isolation, that wasn't used as an opportunity to use that function and send out push notifications. Why was that?
I don't know whether you want to comment on that.
Yeah, I don't have specific information on that. What I do know is that Countdown sent out notified the people who'd used their one card who had been in the store during the period of time. And I've just talked with the team, and they're actually following up with Countdown, and we're going to follow up with other supermarket chains as well as Flybys and Air New Zealand about the opportunity to use push notifications out with the details they hold. All these tools are helpful in terms of us informing people. I don't have any information about whether it was considered to use the COVID Tracer app to push out notifications, or whether it was looked at, but it was found that there wasn't anyone who had been there in that period, but I can check that.
And according to my calculations, Since the 10th of this month, only 1,371 new posters have been created, which isn't a lot for businesses. So more people have downloaded it, but businesses aren't sort of keeping up with creating posters. What is stopping that? Like, why aren't businesses creating more posters?
I think, as Dr. Bloomfield mentioned before, earlier on in the piece, it was more difficult to create posters, and I think some people may have just been put off by that experience and have not come back and had another go. Since then, it has been made easier, and we have seen a flurry of activity overnight as a result of the quite extensive, coverage and conversations that we had about this yesterday, and that's a really positive thing. So we'll continue to sort of push those messages out to businesses using the existing mechanisms we have through MB, for example, through the company's office, getting messages out that way. Those messages are continuing to go out. But the message really is, it is easier. So if you tried once before and were put off, have another go now. It's much easier.
So you are sort of just, are they doing enough, what am I thinking? Are they being responsible enough of creating posters? Or would you urge them to create more?
Look, I would like them to do more. I think that there are some businesses out there who have got a QR code on display, but it might not be one of our QR codes. So they feel that they're doing their bit, and they maybe have not made the distinction that actually one of the official COVID-19 Tracer app QR codes is the most useful one that they can have on display at this point, because many of those other systems are barely being used now. And so it would be good, we would strongly encourage them now to make sure they've got the official COVID Tracer app QR codes on display.
Hipkins, it was announced today that a rugby championship was likely to be coming to New Zealand. Would those teams have to pay for their own quarantine, self-isolation, and what are the government's thoughts so far on it?
So my understanding, I've been advised this morning, that proposal sits with the Minister for Sport, my good friend and colleague Grant Robertson, and he'll ultimately make decisions on that. But yes, they would have to cover their own costs.
Do either of you know how many more New Zealanders plan to return to New Zealand and whether we'll need more isolation facilities in the coming weeks?
Look, it's one of those things where it's quite difficult to gauge how many New Zealanders may or may not be deciding to come home. And so we're working very hard with the airlines to forecast potential future demand for managed isolation facilities. The airlines have been very cooperative with us in that regard, and I hope that constructive relationship will continue.
And are we likely to need more facilities in the coming weeks or months?
Look, at the moment our strategy is on managing the facilities that we have and managing demand to ensure that we can accommodate people when they arrive. And as I've said, the airlines have been very cooperative with us on that. I think and we're not unique in this. Other countries who have similar facilities are going through exactly the same process.
So do you think we've kind of maxed out the capacity for staff to manage the current number of people?
Look, I think one of the things that I really was emphasised to me when I visited the facilities myself is this is not just a simple process of saying to someone, here's a hotel room, go and stay in there for 2 weeks. There's a lot that goes into running these facilities. There are a lot of people involved. So it's not just a question of how many hotels do we have that we can put people in. You've then got to have a whole lot of other things to support that, including the security, including the health teams, including all of the systems and processes that need to go around that as well. So at the moment, we've scaled this up quickly. We've had a period of time now to consolidate that over the last week or so to make sure that everything is absolutely robust. I think scaling it up further, if we don't have to, it would be good to avoid that. So if we can manage to manage demand so that we don't have to do that, I think that would be preferable.
On the case today, for either one of you, with the child becoming infected, what's the process for family if one does get infected? Do you move the whole family on the assumption that because it's so infectious they will all be infected, or how does that work?
Yeah, that's exactly what we do. So they move from the facility they are in into the quarantine facility, wherever they happen to be. In Auckland, that's a separate facility. And then there's a high level of suspicion that other family members are likely to become infected. So in this case, the child had been tested already at least once, if not twice, with negative swabs, but was retested again because there was a high likelihood of infection within that bubble. And this is what we saw when this virus was in the community, that most infection happens within the household setting.
Can I just take a moment too? Obviously, I was not given any personal details of any of the people in quarantine, but I do want to acknowledge some of the families there. They've had quite a long stay, some of them, because where there is transmission between members of a family, that has the ultimate effect of extending the stay, often for the whole family. And so I do want to acknowledge those families, it is difficult, particularly if you've got young children, to be in that confined space for that period of time. They are making a big sacrifice for all of us, and I want to acknowledge them. It is difficult.
What's the longest someone's spent in one of the facilities?
I don't have that.
I was just having a look at this yesterday, so I think it's around somewhere between 28 and 30 days. And the data I was looking at yesterday, and this was part of the memo around our classification of people as recovered, they all stay at least the 14 days, and only a quarter of them had left between day 14 and day 16. So most of those who test positive, often because of the other members of their bubble becoming infected, end up staying for quite a long period of time, and possibly up to even the whole month.
Sorry, so only a quarter of people who test positive in the facilities leave in that 14 to 16 day
Had
window.
left at that 14 to 16 days. So the vast majority of them were staying at least 16 plus days, because they're often detected on that day 3, and or other members of their family bubble, if they're in a bubble, may become subsequently infected, and then the clock goes back as well. So they have to wait until everyone has had that at least 10 days since symptom onset or positive test if they're asymptomatic, and at least 48, soon to be 72 hours symptom free.
Do they get any extra support if they're staring down the barrel of like a month-long stay?
Look, again, one of the things that I saw there was in the health team where they were supporting people, they had a whole stash of nappies and toys and other things to keep kids entertained. And again, that's why I mentioned this, because I do want to acknowledge those families. I mean, I've got 2 young kids. Being at home for 5 weeks of the lockdown was a big enough challenge. And we've got quite a big house. So being in that confined space with young kids will be very, very challenging for those families. The feedback that I have had from the staff who are working in the quarantine facilities is that these families have been amazing. They have been doing the right thing. They understand why they're there. They're being incredibly cooperative. And so on behalf of the whole country, I want to thank them for that, because what they're doing is very, very important.
With both hats on, are they getting these children? Do they then get education facilities and that sort of thing as well? Because that is a really long time to be.
Yes, we are. The packs, the hard packs of materials that we sent out during the lockdown, we are making those available to families in managed isolation and in quarantine, so that they can support their kids to continue learning whilst they're there. Any other questions? Very quiet day. Thanks, everybody. We'll see you. We're not here tomorrow, so we'll see you next week. Thanks.